Thank you so much, Michael, for the opportunity to be here. And Dr. Zhao, it's really a pleasure. I'm going to focus my remarks on the importance of health and well-being. Indeed, these are extraordinary times, times of unsettling uncertainty, punctuated by imperfect information and many unknowns about the issues and policies that will significantly impact our health and our health care. Yet, along with this uncertainty comes potential and possibility for hearing and amplifying the voices of people from all sectors of our society about really what matters to them and to their communities, especially related to their health and well-being. The priorities released today from the National Academy of Medicine's initiative, VitalDirections, provides us with an important lens through which to consider a path ahead during these uncertain times, especially when we focus that lens on empowering people and activating communities towards reaching their full potential for health and well-being. Of great importance in this discussion is what has been widely cited across a number of the publications, that for the most part, the opportunities for achieving better health and well-being for individuals and community occur outside the healthcare system. We've heard that over and over again, especially in a healthcare system that has largely focused its vast resources on treating disease and restoring health, both incredibly important, but far too narrow and too often provided too late to ensure the health and well-being across the lifespan of individuals. It's time to rethink how we will reallocate resources to support the multidimensional model to bring health and well-being home, to the places where we live, where we learn, where we work and play, where we eat and otherwise spend our time. Frankly, I actually can't imagine a better time or a more appropriate time than right now to launch a national conversation on this topic of health and well-being. The country is poised at a critical juncture. Many people of differing views are seeking a common ground around which we can coalesce. I dare say I'm not going out on a limb to suggest that most people would agree that having health and well-being just matters a lot, maybe more than anything else. So how might we get there? Well, let's begin with a national conversation to better understand what better health and well-being actually means to people in their communities. Let's simultaneously stimulate this conversation at many levels, from community leaders to public health, to educators and businesses, to local and state government and industry, to really better understand what's already underway and where the gaps exist. Let's bring health home where it belongs, and let's do it together. Importantly, the new administration can demonstrate its commitment by imagining the appointment of a special advisor on health and well-being, whose first responsibility might be to do a comprehensive assessment of the cabinet to identify opportunities where each secretary's domain could have a collaborative approach towards health and well-being of people and communities. That could be aligned across a multidimensional blueprint for integrating health and well-being into a national agenda. Consider how the Secretary of Transportation can ensure the policies and infrastructure development to take into consideration the need for people to have access to an Uber-like transportation experience, whether it's for driverless cars in remote areas to get to medical appointments, or light rail to link rural communities with urban amenities. Imagine the State Secretary of Agriculture has a strategic goal included to look specifically at nutritional foods as a health intervention, reminiscent of Jack Geiger's prescription for food for malnourished kids in 1965. This is not a new idea. We've been doing these kinds of things in pockets of brilliance and disruptive ideas around the country for many years. He said, the last time I checked for treatment for malnutrition, it was food. Another opportunity is Department of Housing to explore programs such as Housing First in Boston that includes a Hughes program that has successfully reduced the highest utilizers of expensive emergency services by simply providing stable and permanent housing. Imagine public-private collaborations to bring digital divide to zero. I've spent over 4 decades in healthcare, much of it intentionally outside of and along the fringes of the traditional delivery systems in academic medical centers. Instead, I chose to experience my practice in the company of people, in their communities, in their homes, around their kitchen tables, with their families and others close to them. This, to me, was the essence of fostering health and well-being. Community-based and place-based care teaches you very quickly how misaligned the healthcare system is from what truly matters to everyday people in their everyday lives. Even after 42 years at this, I feel like every day is new, and the sense of urgency that matters to patients and caregivers that they have always felt is now acutely being felt by the system itself. There's no question that we are overdue for change. We all recognize that, yet too often we fall back to tweaking the current system because true change requires too much risk and uncertainty. Well, you know what? Risk and uncertainty are part of what I call the everydayness of being. They are a part of life. People, patients, caregivers understand this and face risk and uncertainty every day with varying degrees of readiness and resilience, more often not with the kinds of supports they deserve. Let's advance NAM's vital directions by creating a national conversation that clearly positions health and well-being of individuals and communities as a national priority that will fundamentally shift how we continuously learn about health, not simply healthcare. Thank you.